Hello Medicos. Let's get started for today's 50 MCQ for pharmacology. Duration of action of flumazenil is firstly, flumazenil is the antagonist of the benzodiazepine. It is act on the GABA receptor and it is the use for antidote of the benzodiazepine. The action of flumazenil is the 30 to 60 minutes, but the option is not given 60 minutes, so I write 30 minutes is the right answer. Done? Yes. Second option, 1 minute guys. Okay, so all are true about Remeltion. Remeltion accept so agonist of the anti or empty receptor is a substrate for CYP1A2. It is the enzyme which is present on the liver. Has high addiction liability, approved for treatment of insomnia. So Remeltion is the high addiction liability. It is addiction like morphine is also high addiction liability, so answer C is right. All of the following statement about flumazenil are true except it is a specific antagonist of benzodiazepine. It may be used to treat barbiturate poisoning. It is given intravenously. It acts on same site on GABA channel where benzodiazepine bind. Firstly, it is the specific antagonist to benzodiazepine. So A is correct. D also seen, it acts same site on GABA channel where benzodiazepine bind. Okay, so this option is also correct. It given intravenously, flumazenil is given intravenously, or it may be used to treat barbiturates poisoning. So barbiturates poisoning, we not use flumazenil because flumazenil is also only one binding site, benzodiazepine binding site. It is not bind barbiturates binding site on the GABA receptors. Which of the following compound act as a benzodiazepine antagonist? So benzodiazepine antagonist, only first option is correct, flumazenil. Naloxone is the morphine antagonist. It is used as a morphine antidote. Naltrexone is also morphine antagonist. The effect of thiopentone on the CNS is quickly terminate because of rapid metabolism in the CNS, quick first pass elimination, redistribution, rapid metabolism in systemic circulation. So thiopentone is the barbiturates group drug, and thiopentone is the highly lipid soluble drug. So the action of thiopentone is very low time action, and it is CNS quickly terminate because of the redistribution. All of the following benzodiazepine can be used in elderly and those with liver disease except. So stol is the mnemonic for used drug which is used in liver disease, and this drug is not metabolized by liver. So stol S for short acting benzodiazepine, T for triazolam, O for oxazolam, L for lorazepam, E for idazolam. Inverse agonist of the benzodiazepine receptor, it is beta carbolin. Beta carbolin is the inverse agonist to the benzodiazepine receptor. Which of the following agents binds to GABA receptor chloride channel complex? So zolpidem is the Z group of the drug. It is bound to the GABA receptor on the chloride channels complex. It acts on the GABA receptor or chloride channel complex. In which of the following disorder administration of the barbiturates is the contraindicating? Remember students, barbiturates is the contraindicated in acute intermediate porphyria. Also, phenobarbital is the drug which also causes the hyperkinesia in the children. So, phenobarbital is not used in children. This is remembering point for barbiturates. Which of the following agents do not act via GABA Cl channel complex? So, which the zolpidem? B option is not right. Thiopentone and promethazine. So, promethazine is the acts on the GABA Cl minus channel chloride channel complex receptor. Promethazine. Okay, drug that can be used safely in porphyria. So uh, two drugs option is six option is given, two drugs which use in the porphyria safely, midazolam and pethidine. This points is remembering point. Which of the following statements are true regarding a benzodiazepine? True regarding diazepam is a short acting benzodiazepine. A wrong answer. Diazepam causing lesser respiratory depression that midazolam. Wrong answer. Diazepam has higher abuse potential than midazolam. Wrong answer. Mitrazepam is metabolized in liver. Right answer is D. D is the right answer. Or first A option is the GABA agonist. 12 it acts as a GABA agonist. So benzodiazepine is the not gamma mimetic drug. It acts on GABA but it is not agonist to GABA. This point is remembered. So true is the D option. Which of the following drug is the antagonist to diazepam? Antagonist. So remember, diazepam antagonist flumazenil, because flumazenil is the use for antidote of the benzodiazepine. Which of the following contraindicated in acute intermittent porphyria? Thiopentone, because thiopentone is the barbiturates group drug. Action of flumazenil on benzodiazepine receptor. Antagonist. Both barbiturates and salicylate are maximally absorbed in stomach because they are this point is remember, barbiturates and salicylate is weak acid and do not ionize in stomach, so which is maximum absorbed by the stomach. Weak acid and do not ionize, so highly absorbed from the stomach. Which drug? Barbiturates and salicylate. Which of the following drug is not metabolized by liver? The oxazepam is the drug which is not metabolized by liver. Remembering students, stall is the mnemonic. S for short acting benzodiazepine, T for stall, T for triazolam, E for stall, O for oxazolam, L for lorazepam, E for irazepam. So oxazepam is a stall drug, so it is not metabolized in liver and it is used in the liver disease. Short acting benzodiazepine, so midazolam is a short acting benzodiazepine. Which of the following drug is metabolized by liver? So oxazepam is the not metabolized by liver. Okay, not metabolized by liver is the oxazepam. Short acting benzodiazepine, midazolam. Short acting benzodiazepine among is, so triazolam is a short acting benzodiazepine. Flurazepam long acting, aprazolam is a long acting. Okay, most effective not habit forming sedative. To zolpidem is the Z group drugs, so it is the not habit means not addiction liability of zolpidem. Antagonist of the benzodiazepine, flumazenil is the antagonist. Which of the following drug does not affect GABA gated chloride channel? So baspiron is a not act on the GABA gated chloride channel. Mesmeron act, alcohol act, picotoxin act. The specific antidote for benzodiazepine, flumazenil is the poison antidote for benzodiazepine poisoning. Which of the following drug is effective in painful tingling sensation due to diabetic neuropathy? So remember students, the GABA means gabapentin is a drug which is used in the neuropathic pain, treat to neuropathic pain. So diabetic neuropathy is treated by gabapentin. Which one of the following is not true about melatonin? So melatonin induced sleep used in treatment of jet lag syndrome. It is the pineal gland hormone. It is not secreted by pituitary. All of the following are CNS stimulant except benzodiazepine is not CNS stimulant. Peripheral vasospasm is absorbed with which of the following antiparkinson drugs? So bromocriptine. Bromocriptine is a drug which causes the peripheral vasospasm. DOC for relapsing remitting multiple sclerosis. So beta interferon. It is the drug of choice for relapsing remitting multiple sclerosis. Which of the following drug effective in improving EDSS in multiple sclerosis? So natalizumab. Natalizumab is a drug in effective improving EDCS multiple sclerosis. Which of the following drug is not used in multiple sclerosis? The mycophenolate mofetil. Mycophenolate mofetil is a drug which is not used in multiple sclerosis. Which of the following drug is used as the transcranial patch for Parkinson's disease? The rotigotine. This is remembering point, students. Rotigotine is the drug which is used as a transcranial patch for Parkinson's disease. Which of the following, if combined with the rivastigmine, which decrease its efficacy? So tricyclic antidepressant, which is combined with rivastigmine and its causes to decrease rivastigmine efficacy. All of the following statements about triantipine use in Wilson disease are true except it is more potent than penicillamine. All of the following statement about triantine used in Wilson disease are true except it is the potent than penicillamine. Okay. Which of the following agent enhance the bioavailability of levodopa in patient in Parkinson disease? So Antacopan enhance the bioavailability of the levodopa patient in the Parkinson disease. All of the following statements regarding levodopa are correct except in Parkinson, phenothiazide reduce its efficacy. Okay, it is a prodrug. Pyridoxine reduce the effect of the levodopa in Parkinson. Yes, this is true. Domperidone blocks levodopa induced emesis. This is wrong. A patient of Parkinson is managed with levodopa if vitamin B complex is administered concurrently the patient. Okay, so the decreased efficacy will result because the vitamin B complex pyridoxine is acts on a dopamine decarboxylase receptor and enhance the activity which peripheral conversion of the levodopa to dopamine will increase and it causes the decrease the levodopa in the brain. Ropinirole is the most useful for the treatment of Parkinson disease and it is used as the transcranial patch. Which of the following statements is false regarding the drug used in the treatment of Parkinson? Amantadine is more effective than the levodopa. Yes, this is true. Drug used in treatment of the Parkinson, तो levodopa, it is the डोपामाइन प्रिकर्सर में यूज था सर ब्रोमोक्रिप्टिन डोपामाइन एगोनिस्ट है बेंसेराजिड इज ऑल्सो यूज्ड इन पार्किंसन डिजीज ड्रग कॉज इन पार्किंसन इंक्लूड्स phenothiazide haloperidol is also used in Parkinson disease. Drug causing Parkinsonism include phenothiazide, yes, haloperidol, yes, also. Which of the following drugs should not given along with the levodopa? Vitamin B complex, yes. Drug of choice for Parkinson disease, DOC for drug induced Parkinson disease, benzaxol. Which of the following of levodopa? The 43 MCQ is not correct. Which of the following drug is used in Alzheimer disease? Doxapram is used in Alzheimer disease. Yes. Which of the following is not used? Ropinirole, because ropinirole is used in the Parkinson disease, is used by transcranial patch. In the treatment of Parkinson, levodopa is combined with to increase the because combined with carbidopa, because it increased the levodopa crossing through BBB, blood-brain barrier. Which of the following nootropic drug which increase the memory power, increase nootropic drug which increase memory power? So paracetam is a nootropic drug. Yes. Mechanism of action of donepezil, centrally acting irreversible anticholinesterase. Uh, Anti-Parkinsonism drug that is a selective COMT inhibitor. Selective COMT inhibitor anti-Parkinson drug is entacapone. Tolcapone and altacapone is the COMT inhibitor which is used in anti-Parkinson drug. True statement about drug-induced Parkinsonism. Amantadine is the cholinergic drug. Wrong statement. Vitamin B6 enhance levodopa. Wrong. Decrease levodopa concentration. COMT inhibitor prolong action of levodopa. Yes. Entacapone and tolcapone which increase the bioavailability of levodopa. Yes.